Hi, I'm Phil Hart, and on behalf of our investigative team and the Consortium for the Study of Chronic Pancreatitis, Diabetes, and Pancreatic Cancer, happy to present our abstract data entitled The High Prevalence of Decreased Bone Mineral Density in Chronic Pancreatitis, a cross-sectional analysis from the PROCEED study. For background, chronic pancreatitis is associated with decreased bone mineral density, which includes both osteoporosis and osteopenia. Existing studies to date have looked at this question, although are limited in relation to the nature of study design and have been unable to definitively define risk factors or mechanisms of bone loss in chronic pancreatitis. So our current aim was to identify patient and disease-related associations with decreased bone mineral density in chronic pancreatitis. To accomplish this study, we selected patients with chronic pancreatitis who are enrolled in an ongoing cohort study called the PROCEED study from 2017 to 2019. In this study, patients are offered a baseline DEXA scan as part of the research study protocol. Bone mineral density was measured using the lowest T-score from the spine or the hip location. The study participant flowchart is shown to the right, illustrating that a final study cohort of 260 subjects was identified. We performed a number of comparisons and ultimately developed a multivariate logistic regression model. In our study, 56% of subjects with chronic pancreatitis had decreased bone mineral density, including 17% with osteoporosis. Importantly, many of these patients had decreased bone mineral density even in the absence of traditional risk factors. For example, almost half of all male subjects had decreased bone mineral density. In the subjects with decreased bone mineral density, there was a higher prevalence of both traumatic and spontaneous fractures that was observed. On our multivariate model, we identified older age, female sex, lower BMI, and a history of cigarette smoking as predictors independently of an increased risk for low bone mineral density. And importantly, although we looked at a variety of disease-related factors, such as etiology of chronic pancreatitis, pancreatic morphology on imaging, a history of endoscopic therapy, or duration of chronic pancreatitis, none of these factors were associated with decreased bone mineral density. So in this largest study of chronic pancreatitis patients to date with DEXA scans performed, the majority of subjects had decreased bone mineral density. This decrease in bone mineral density was associated with older age, female sex, decreased body mass index, and cigarette smoking. However, the lack of associations with any disease-related factors highlights the need for ongoing investigations to further understand the mechanisms of altered bone turnover in this patient population. With that, I'll thank you for your attention, as well as to thank my collaborative team from the Consortium for the Study of Chronic Pancreatitis, Diabetes, and Pancreatic Cancer for their involvement in this study. Thank you.